When you consult an oncologist, after the initial introductions and the reports, they take you through this maze called oncology. Right from step one, diagnosis, then to treatment, then to prognosis, the side effects of the said treatment, the quality of life after it. Following which, your cancer is cured or controlled. But remember, cancer has existed since 3000 BC. That's almost 5000 years. And it takes an oncologist 3 to 5 years to understand what is cancer. But for a patient, it's supposed to take 30 minutes of the consultation time. Very unfair, but that's reality. Because of which, you have a lot of sleepless nights and endless questions. Is this the right treatment? Will the treatment work? What is my prognosis? Can I bear the cost of treatment? Just as a student has to prepare for his exam, you as a patient have to learn to understand what you're dealing with so that you can have peace. And this is important because this will help you have more satisfaction with what's going on, more emotional control, and you can take wise treatment decisions. Before we go into today's topic, I would like to talk about what happens before consulting an oncologist. Usually, you end up going to an oncologist because your primary doctor feels that there is a possibility of cancer. This suspicion of cancer itself makes you go down roller coaster of emotions. So, primary among them is fear. Fear is because cancer is life threatening. It's an expected emotion. This is because when there is a diagnosis of cancer, it's like you're in a battlefield. You don't know where the shots are being fired from. You don't know who your enemy is. You don't know whether to go backward or forward. This causes a lot of confusion. The main thing here is staying calm, knowing that these emotions are expected, and then knowing your enemy. Is it a small tumor or is it a slightly complicated tumor? Both of which have got very good treatments, and rarely will it be the devil that you have to deal with. So after fear comes other emotions like anger, denial, depression, unfair. All this is because had your own experiences with cancer from your friends and family, and also the society, your neighbors add on to these experiences, so which adds a lot of burden, and rather than going forward, you take multiples of steps backward. So how to overcome this? One is to get knowledge and communicate with the right people. And in that sense, these are definitely not the right people to talk to about. Google and YouTube, yes and no, it's a double-edged sword. If you know the right resources and you're emotionally capable of handling things, yes. If not, it only adds to your burden. So this is why you need to consult an oncologist. When you meet an oncologist, you gain knowledge so that you can plan things and take action. Just as it is important between a student and a teacher to have trust, for a student to accept what the teacher says, and for a teacher to understand the type of treatment and give the appropriate knowledge, so it is important between a patient and a doctor. This trust can happen at any time, can happen after diagnosis, during treatment, or during follow-up. But remember, it is always important for trust to be formed. If you don't have trust, you have less satisfaction with your treatment, you're in more emotional distress throughout your treatment, you have got a lot of treatment irregularities, you may not be even interested in taking treatment. Remember, an oncologist support is unconditional regardless of the prognosis, the treatment options, and the choices. 70% of us, after the first consultation, you have a good bond with your oncologist, but 30% you still have a lot of doubts and you're very anxious. Then you go for a second opinion. By that, I don't mean you diagnosing yourself on the internet and going to your oncologist. No, you go for a second opinion in 3 instances. 1, when you're not satisfied. 2, when it's a rare or an advanced cancer. 3, when you want a different opinion on treatment. The alternative to an individual consultation is a multidisciplinary tumor board where all your oncologists, like your medical, radiation, and surgical oncologists, and allied specialties like pulmonologist, neurologist, your intervention radiologist, and pathologist, go through your case in detail, understand what your opinion on treatment is, and come up with a comprehensive plan. This is because no cancer has a straightforward treatment. It has got its own intricacies. Sometimes it may be a simple treatment, sometimes it's going to be complicated. And secondly, there are a lot of oncologists there. So some may know what is the latest treatment in your field, and they might give a better opinion on it. And this may have a huge bearing on your treatment. Simply put, 6 eyes will see more than 2 eyes. Then, if suppose your hospital does not have a tumor board, you can go for a virtual tumor board, like example Navya, where they take your reports and take opinion from exemplary institutes in our country like Tata, AIMS, Max, and Adia. If you're still not satisfied, I would say there are 3 patients you have to talk to. The first patient is someone who has won against cancer, and by that who has lived 2 to 3 years after the completion of treatment. The second patient is who just completed treatment, so that you would understand what all emotions they have gone through, the side effects, the benefit of the treatment they have gone through so far. The third patient is patient who just started treatment, so that you have got a companion, someone to share to and take emotional support from them. Finally, spirituality. Going to the temple, the mosque or the church give a lot of support. Ultimately, after all this, you'll have a desire to fight, you hope for the better, and you resolve to take the next step. And coming to today's topic, diagnosis of cancer. Diagnosing a cancer is like solving a crime investigation. To solve a crime, you must ask the right questions. Coming to the topic for today, questions to ask before diagnosis. There are three sets of questions. First question is the beginning. Just like when a crime has been committed in India, we file an FIR. In oncology, the question we ask is, how did it begin? When you have symptoms of cancer, or when you go for a health checkup or screening, or by chance. Usually when you have symptoms of cancer, it is a stage 3 or 4 disease. When you have health checkups and screening, then probably stage 2, can be stage 3, rarely stage 4. And by chance, I mean, you go in for a diagnosis of examination on your history, doctor finds something suspicious, further investigations are done, and you end up with a diagnosis of cancer. Rare, but this can also happen. The second question is, where is it? Where is the location of the crime? So there are good locations when a crime has happened. A good location is where you have got cameras to know where the crime is and how did it happen. A bad location is where you've got no cameras and no witness. In oncology too, we have the same. A good location of a cancer is where we can scan it, see it, and then do a biopsy. A bad location is where we cannot scan or we cannot do a biopsy. In oncology, the cameras that we have are a CT scan, a mammogram, and an ultrasound. A CT scan, all of them give us a black and white images. A CT scan will help us identifying bone, lung, and abdominal cancers. A mammogram for breast and ultrasound for ovarian. Blood cancers are far more simpler. A few ml of blood running by a machine will give us a differential, which will tell us probable cancer. If it is suspicious, we ask for a peripheral smear, where some amount of blood is examined under a microscope, and the pathologist will tell you whether it is normal or abnormal. Solid cancers too can be diagnosed with the help of blood, provided the said tumor secretes some hormones, for example alpha fetoprotein, CA19.9, CA125, CEA. So now you've done a scan and some blood tests, and then possibly it looked like cancer. So the next thing is it cancer or not? How do we confirm it? So just like when a crime has happened, the police chase after the suspect. This chasing in oncology is called as biopsy. Biopsy is pretty simple. You scan, you localize the tumor, you put a needle in, you remove some tissue, send it to the pathologist. They examine under the microscope and tell whether it is normal or abnormal. Then the pathologist will write a document called the biopsy document, where it is reported that it is cancerous. Now this is a legal document. This is the proof that you have got cancer. Blood cancers, again, a few ml running by a laser machine. It will identify the structure of the cell and it will tell you whether it is a normal structure or an abnormal structure, and thereby telling us whether it looks like malignant or not. For example, how did it begin? So a patient with complaints of lump in the right breast since 3 months. So we understand that this is the beginning. The next question is, where is it? For breast, the ideal scan is a mammogram. In a mammogram, there are some criteria. Based on the criteria, we will think whether it is suspicious of cancer or not. So since we know the location now, we want to know whether it is cancer or not. For this, we end up doing a biopsy. Small needle is placed into the tumor and it is removed and it is examined by a pathologist. So let's just say there are two patients. Both of them had complaints of swelling in the breast. We did the biopsy of the breast mass in both the patients, and in one patient it came as invasive ductal carcinoma. The other patient it came as fibroadenoma. Can you tell me which is cancer or not? Right. Invasive ductal carcinoma is cancer. Fibroadenoma is a type of cancer which is very benign. It will not cause you any harm. So you understand, based on the symptoms and based on the location, it's very difficult. Only a biopsy can finally tell you whether it is cancer or not. So after answering all these three questions, the diagnosis of cancer is confirmed. We have caught the culprit. Now, the next question is about whether this cancer will pose a risk to life or not. So this I'll be talking in my next video. I hope you like this video. Kindly like, subscribe and share. Thank you.